Fashana Health Center, the only medical facility in the entire Fashana region. At a glance, it doesn't look like much, but this humble health center is literally a lifeline for residents here. Patients come from as far as 15 kilometers away for free treatment. In the compound, relatives of patients take a nap, exhausted by the long journey. Established by UNICEF in 2011, the center caters to both local residents and at least 28,000 refugees in the nearby Fashana refugee camp. The staff is mainly Chad nationals, but due to severe understaffing, the center has resorted to training some refugees to help out. Fatna Yaya Ali is among those lucky to get employed here. She fled the war in Sudan's Darfur region in 2004. In 2012, she enrolled for medical training and graduated 3 years later.
My advice to my fellow refugees is based on my experience. When I came, I had nothing. I tell them, look at me. I had nothing, but I got education. Now I'm somewhere. I always tell them not to stop learning, to go back to school, and tomorrow will be better for them.
The hospital's maternity department is among the busiest. In a community where maternal health and family planning is extremely low, their job has not been easy.
You'll find a man who fled the conflict with his wife and maybe lost his children. The belief is that they need to replace those children, so they find it difficult to understand the concept of family planning.
The center also has a nutrition department which goes around the area educating both the locals and refugees on benefits of a proper diet and nutrition. But the challenges are not just about changing perceptions. The center is heavily under-resourced. This is the Women and Children's Ward. On average, this health center receives about 7 admission cases a day, but they can only stay here for 3 days. Malaria is the most common disease. Severe cases are driven to the nearest district hospital 57 kilometers away. The road network, though, is another challenge. What should ideally be a few minutes' journey takes hours. Relatives of those who cannot go home immediately pitch tent at the hospital compound, cooking for their sick members until they're well enough to make the long journey back home. Peninah, Karibe, CCTV, in Fashana, Chad.